A quick mention of surfactant, which we will discuss again in the next lecture as well, so I will be brief. The preterm lung is surfactant deficient, and the most common reason for respiratory distress in such babies is RDS, which is due to surfactant deficiency lung disease. Surfactant therapy was experimentally introduced in the late 1980s, and it became routine in the mid to late 1990s. We had synthetic and natural, but now we have only the natural surfactants. The most important ones are porcine Curacao for bovine, and I think there is one more in India which is available. Most of the current recommendations suggest surfactant replacement is given as an early rescue. Previously, we used to give prophylactic surfactant for babies under 28 weeks, but evidence has shown that some of these babies may avoid intubation if you manage non-invasive ventilation appropriately. So if your baby needs intubation in the labor room, you give surfactant immediately for such babies. But if baby is managing on non-invasive, you consider early rescue depending on the FaO2. If it's more than 30-35%, the smaller the baby, you can use a higher threshold, 40% for the bigger babies and 30% for the smallest babies. Even when you need surfactant, it doesn't mean you need to keep the baby intubated and exposed to pressures through the ventilator. There is more studies coming up which show non-invasive surfactant therapy with either Insure or LISA are preferred. Insure, the concept is changing. Previously, we used to say keep them intubated for 2 hours, up to 2 hours, but now Insure is almost the same as LISA with using an ET tube instead of the LISA catheter. So you use the ET tube, which is the smallest size, intubate, give surfactant and remove. And with the availability of RAM cannula and similar options to give high flow or CPAP through the nose, without the need for the setup of CPAP hat and everything, we can keep the CPAP continuing even while you are intubating such babies with a nasal cannula. So the CPAP of 6 centimeter and FaO2 rising, then it's an indication for surfactant. Curacao is preferable because it's a lower volume, and it comes as 1.25 and 2.5 ml. If you give Survanta, it's 4 ml per kilogram. And surfactant improves survival and reduces complications like air leak or IVH. So this baby has been given surfactant and is peaceful intubated. Some of you may have seen the devices used to fix the ET tube. This one is a tape. Preferably if you have a device meant to fix it, it's better like NeoBar or NeoFit. The chest X-ray is severe RD, as you can see, bilateral whiteout or ground glass opacity, some air bronchograms, but because it's whiteout, even the air bronchogram isn't that prominent. You can see the umbilical venous line, which is going up here, and the umbilical arterial line, which is looping down and coming up. And we have the feeding tube, the ET tube.